If you're in South Florida and nervous about the dentist, let's talk about how sedation and sleep dentistry can help.
When a patient comes in with a bad experience, the most important thing is to know what the experience was. And usually it's something that happened a long time ago. In modern dentistry, we don't hear too many horror stories, but when we do, we want to know exactly what happened. We spend time with our patients to find out what is actually on their mind and what they're fearful of. Especially our older population, you can imagine, they were there when there was no Novocaine, they were there just getting dental work done. It seemed like a chore, like a nightmare. Even still now, patients hear the word implant or they hear the word surgery or dental implant surgery. I can understand how people can be afraid of it, but I'm here to tell you, it is not as bad as you think it is. With the advent of guided surgery, sometimes we're placing the implants with no incisions, no stitches. There's also the other side of it. If a patient is very fearful or wants something to relax, we can give them oral medication to relax them, or even better, in our office, we're sedation certified. So we have sleep dentistry. You can come in and get a small IV in your arm, wake up in an hour and be done. But I think that explaining procedures in depth and explaining, this is going to happen when this happens, and giving them a good roadmap on their treatment is probably the best way to allay people's fears as far as dentistry goes, and especially implants. We don't just treat patients, we treat people, so we want to make sure everybody's comfortable.